My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and you said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation from Bangalore.
I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You're able to speak words properly and sentences properly.
Just you try to say something.
Treatment is in there. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar Voice Therapist, and today we are before treatment live with Hanif, and Hanif is having some voice problem and he's not from India, he's from Malaysia, and we are before treatment live today, and today date is 2nd December 2021. In the future we are going to be post treatment live, so please subscribe our YouTube channel and don't forget to watch his post treatment live. So नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे. आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं हनीफ के साथ, और इनको वॉइस की समस्या है और हनीफ इंडिया से नहीं है, ये मलेशिया से हैं, और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं. भविष्य में हम लोग ट्रीटमेंट के बाद भी लाइव होंगे, तो आप लोग हमारे यूट्यूब चैनल को सब्सक्राइब कर लीजिए और भविष्य में ट्रीटमेंट के बाद का लाइव भी जरूर देखिए. और हम लोग इनका ट्रीटमेंट करेंगे ऑनलाइन वॉइस थेरेपी के माध्यम से. हनीफ, प्लीज टेल अस व्हाट एग्जैक्टली प्रॉब्लम यू आर फेसिंग, व्हाई यू कॉन्टेक्टेड अस, वेयर यू स्टे. वी वांट स्पीच सैंपल बिफोर ट्रीटमेंट, and we are YouTube live so that people can hear your voice also.
Okay, hi everybody. Sir, my name is Hanif. I'm from Malaysia. So I'm contacting you because of my high pitched voice. So people easily mistaken me for madam and ma'am because they thought I'm a woman. So female voice actually. I was looking and surveying your YouTube channel, everything, and then I see some of my fellow Malaysian citizens also looking for you, but they went there. But during this pandemic, I cannot attend, so I have to do this online. And I'm glad that you can help me, sir.
Okay. What is your mother tongue?
Yes, currently.
Mother tongue, in which language you speak?
Oh, mother
in your
tongue
home. Sorry?
Malay.
Okay, so can you tell the same thing? What exactly problem you are facing and why you contacted us in your mother tongue?
Oh, okay. In my own. Okay. So saya Hanif. Saya ada check YouTube untuk Sanjay sebab suara saya kecil. So saya bila bercakap orang boleh sangka saya suara perempuan. So jadi saya cari cara penyelesaiannya dengan kontak Dr. Sanjay Kumar, dan saya rasa cukup gembira Dr. Sanjay Kumar boleh cuba bantu saya, dan saya akan lihatlah keputusannya macam mana nanti. That's all.
Okay, thank you Hanif, and you can mute your mic, and in this live we are going to talk why the Hanif is having such kind of voice problem, and we'll talk about the normal speech production mechanism. Is the all high pitch voice are the same? So these are the issue we are going to discuss in this live. And if you can mute your mic, okay, so that the echo will not be there.
Okay.
So let's first discuss why Hanif is having this kind of problem, and to understand that, let's understand the normal speech production mechanism. For normal speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Here we have larynx. Inside the larynx, we have two sting-like structures known as vocal cords. So once you put air pressure below the vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into the different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, if you want to say p, both the lips are coming closer together and touching each other. When you want to say th, tongue is coming between the teeth. When you want to say k, back of the tongue is getting elevated and touching the soft palates. So each and every sound has its own place, manner of articulation. So when you say a one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sounds generate, we modify that sound to different sound. In one sentence, there are so many words. In each word, there are so many sound. Each sound has its own place, own manner of articulation. So it is a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles goes, there will be another communication disorder called stammering or stuttering. When the place of articulation and manner of articulation is wrong, there will be pronunciation problem. So let's discuss the problem what you are having, means Hanif is having here. During puberty, mass and the length of the vocal cord increases due to a hormone called testosterone. Before puberty, there is no much difference between male and the female voice. The reason is that there will be almost same mass and the length. But during puberty, in case of boys, there is a hormone called start secreting testosterone, and because of the testosterone hormone, there will be so many impact. Apart from that, there will be some impact on the vocal cord mass and the length also. So vocal cord mass length increases due to the testosterone hormone. So vocal cord before puberty will be behaving like a thin string of a guitar, but during puberty, due to the testosterone impact, it will start behaving like a thick string of a guitar. And if guitar string is thin, the pitch will be higher, but guitar string is thick, the pitch will be lower. So based on the pubertal changes, you should have the low pitch voice, or people like you should have the low pitch voice. Already I have done the assessment based on that. But why the pitch is still higher? Because from childhood to puberty, you spoke in a high pitch voice, and during puberty, mass of the vocal cord increased, length of the vocal cord increased, and it was ready to produce the low pitch voice. But because of so many years habit, you have not accepted the new voice. Means if this is the vocal cord, so instead of vibrating the whole mass and the whole length of the vocal cord, you may be vibrating thin edges of the vocal cords to maintain your childish voice. Why to maintain the childish voice? Because you have used that childish voice from your childhood to till puberty. So you are finding little difficulty during the puberty to switch on to the new voice. So in that case, what has happened, instead of vibrating whole mass and the whole length of the vocal cord, you started vibrating only thin edges of the vocal cord. And if vibrating mass will be less, vibrating length will be less, means vocal cord will behave like a thin string, the pitch will be higher. So what I will do as a speech language pathologist and a voice therapist, I will try to stimulate whole mass and the whole length of the vocal cord. Suppose earlier it is vibrating like this part, and now I will stimulate and it will start vibrating whole mass and the whole length. So once whole mass and the whole length will start vibrating, the vibrating mass will increase, vibrating length will increase, and the vocal cord will start behaving like a thick string of a guitar. And if guitar string will be the thick, the pitch will be lower. So I'm not going to replace your vocal cord. I'm not going to replace your larynx. So that's why what you're having, just I'll be helping you to stimulate in a most effective way, use in a most effective way, or vibrate in a most effective way, instead of replacing the vocal cord, replacing the larynx, or replacing the vocal cord. So that's why the person to person therapy result vary, because vocal cords, like how the nature has given different height, different color, so same way the vocal cord mass length will be also slightly differ. So based on that, the final results come. And all the high pitch voice are not the same. There is a situation called sulcus vocalis, where the nature will not give sufficient mass and the length of the vocal cord. So in that case also the pitch will be higher, and the voice will look like feminine voice. In some rare cases, there can be hormonal issue, testosterone hormone issues. So due to that also, sometime pitch will be higher. The proper assessment, proper evaluation by a professional is very, very important. And most important thing is I have seen that many people, sometimes they will try voice therapy, and if it doesn't work from one therapist, they will start thinking that they are not a good candidate for the voice therapy, and they will start thinking for the phonosurgery or thyroplasty. But my suggestion is that you try to meet a speech language pathologist, voice therapist who are really expert in this kind of disorder, because this kind of disorder is not very, very common. So maybe you have consulted some speech pathologists, they may be expert in different communication disorder, but not like this. So if they were not able to help, doesn't mean that your body will not respond at all on the voice therapy and you are a candidate now for a thyroplasty or phonosurgery. Or in fact, even after the surgery also you need to take the voice therapy. Then why not you should take first voice therapy. So that is my suggestion, and just for awareness I was telling. And I'll be also discussing about the question answer. Those who are watching this live, I want to say thank you all for joining us and watching us. Here Akinder is saying hi sir, hi Akinder. Rajkumar Rajput is saying hi sir, hi Rajkumar Rajput. Vishal Thakur is saying hello sir, hello Vishal. Govind Kumar Misra is saying hi sir, hi Govind Kumar Misra. And Govind Kumar Misra is saying sir, मेरा एंडोस्कोपी हुआ है, उसमें सब नॉर्मल है, लेकिन मेरा वॉइस लड़की जैसा है. गोविंद कुमार मिश्रा, आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनेंगे, समझेंगे, फिर गाइड करेंगे. और हमारा जो कॉन्टेक्ट डिटेल्स है इस वीडियो जो ये लाइव चल रहा है इसके डिस्क्रिप्शन में जाएंगे तो मिल जाएगा. तो आप हमें कॉल कीजिए, आपकी आवाज़ को सुनेंगे, समझेंगे, फिर अकॉर्डिंगली गाइड कर पाएंगे. Dhananjay Kale is saying, hello inspector sir, I hesitate while speaking and main reason is that my voice is like, means it's like cracking bass, but not like that much, but I want to make voice actually a little bit high pitch. So Dhananjay Kale, please call us again. Suggestion is for you the same. We'll do the perceptual evolution and depending upon that we'll be able to guide you. So thank you Dhananjay Kale for asking question and watching this live. And thank you all for joining us and watching us. And whenever you are planning to take voice therapy or speech therapy, speech language therapy, always you should take from the professional who was really certified in this field or they have the valid degree. And in India, in fact, if you are not able to find the master degree holders in the speech language pathology, even you can take those who are having at least bachelor degree. But in US and all, to give the voice therapy or speech language therapy, you should have minimum master degree. So always try to find, when you are going to take the therapy, your speech language pathologist, speech therapist, voice therapist, audiologist, where he has studied, if you are going for hearing evolution and hearing testing as well. And then what degree he is having or she is having, bachelor degree or master degree, from which college he got the degree, from which university he got the degree, in which year he got or she got the degree, and he or she is registered in the Rehabilitation Council of India or not, and if he or she has registered, what is the registration number? Try to find all this information, and those will be fake speech language pathologists, fake speech therapists, fake voice therapists. They will not put this information on their social media page, or so you can find out. And so this is just for awareness creation. So मैं हिंदी में भी I will talk in Hindi also in my mother tongue. So I always try to create awareness about the communication disorder and try to expose the fake speech language pathologists and fake speech therapists, those who are harming the people's voice or their life indirectly or indirectly. So whenever you are taking the speech therapy, जब भी आप speech therapy आप लेते हैं, तो सबसे पहले पता कीजिए कि आपके जो स्पीच थेरेपिस्ट, स्पीच लैंग्वेज पैथोलॉजिस्ट हैं, उनके पास क्या डिग्री है, कौन से कॉलेज से डिग्री प्राप्त की है. बैचलर की डिग्री है स्पीच एंड हियरिंग साइंस में, स्पीच लैंग्वेज पैथोलॉजी ऑडियोलॉजी फील्ड में, या मास्टर की डिग्री है. फिर उन्होंने कौन से कॉलेज से डिग्री प्राप्त की है, कौन से यूनिवर्सिटी से उनका कॉलेज एफिलिएटेड था, रिहैबिलिटेशन काउंसिल ऑफ इंडिया में रजिस्टर्ड है कि नहीं रजिस्टर्ड है, रजिस्ट्रेशन नंबर उनका क्या है. इन सारे चीज़ों के पीछे पड़ जाइए. कई बार फेक लोग भी ABCD कुछ डिग्री अपने नाम के साथ जोड़ देंगे, लेकिन कॉलेज का नाम नहीं बताएंगे, उनका यूनिवर्सिटी का नाम नहीं बताएंगे. तो ये भी एक तरीका है उनके बारे में जानने के लिए. और ऐसे लोग, जो लोग आपको नुकसान पहुंचाते हैं, किसी भी तरह का नुकसान पहुंचाते हैं, अपने नाम में स्पीच थेरेपी लगा के, स्पीच लैंग्वेज पैथोलॉजिस्ट लगा के, तो आप रिहैबिलिटेशन काउंसिल ऑफ इंडिया को रिपोर्ट कर सकते हैं. रिहैबिलिटेशन काउंसिल ऑफ इंडिया स्ट्रॉन्ग लीगल एक्शन लेती है. तो ये जस्ट मेरी कोशिश थी एक अवेयरनेस क्रिएट करने के लिए. और हम किस तरह का कम्युनिकेशन डिसऑर्डर का ट्रीटमेंट करते हैं, हमारे सेंटर पे किस तरह के कम्युनिकेशन डिसऑर्डर का ट्रीटमेंट होता है. इफ़ यू विल एक्सप्लोर आवर यूट्यूब चैनल प्लेलिस्ट, यू विल बी एबल टू फाइंड if you want to know what are the communication disorder, for that we provide our services. Once you explore our YouTube channel playlist, you will get an idea. तो जब भी आप हमारे YouTube चैनल के प्लेलिस्ट को एक्सप्लोर करेंगे तो आपको पता चलेगा कि हम किस तरह के कम्युनिकेशन डिसऑर्डर का ट्रीटमेंट करते हैं. हमने सेपरेट प्लेलिस्ट बना के रखा है डिफरेंट कम्युनिकेशन डिसऑर्डर का. जैसे कि अगर आप हमारे YouTube चैनल के प्लेलिस्ट को एक्सप्लोर करेंगे तो आपको प्लेलिस्ट मिलेगा प्यूबरफोनिया का, हाई पिच वॉइस का, स्टैमरिंग का मिलेगा, वोकल कॉर्ड पैरालिसिस की वजह से जो डिस्फोनिया हो जाती है, हॉर्स ब्रीदी वॉइस, उसका प्लेलिस्ट मिलेगा. आपको एफेजिया का मिलेगा प्लेलिस्ट जो कि स्ट्रोक के बाद हो जाता है. मिस प्रोनाउंसिएशन, मिस आर्टिकुलेशन का प्लेलिस्ट मिलेगा. फोनेटरी गैप का प्लेलिस्ट मिलेगा. सल्कस वोकलिस का प्लेलिस्ट मिलेगा. स्पास्मोडिक डिस्फोनिया का प्लेलिस्ट मिलेगा. फंक्शनल एफोनिया का प्लेलिस्ट मिलेगा. फंक्शनल डिस्फोनिया का प्लेलिस्ट मिलेगा. और इनफैक्ट हमने हियरिंग टेस्टिंग करके जब हियरिंग एड सुनाई की मशीन पेशेंट को लगाई तो उनकी कम्युनिकेशन कैसे इंप्रूव हो गई, उससे रिलेटेड वीडियोस भी हमारे यूट्यूब चैनल के प्लेलिस्ट में मिलेंगे. और सारे वीडियोस जो होंगे वो प्री एंड पोस्ट ट्रीटमेंट दोनों होंगे. तो जब आप एक हमारे यूट्यूब चैनल को के प्लेलिस्ट को एक्सप्लोर करेंगे तो आपको पता चलेगा कि एक सर्टिफाइड स्पीच लैंग्वेज पैथोलॉजिस्ट ऑडियोलॉजिस्ट लोगों की जिंदगी को कैसे बदलते हैं उनके कम्युनिकेशन डिसऑर्डर को सॉल्व करके. और मैं सर्टिफाइड यूज़ कर रहा हूं तो मुझे भी अपनी डिग्री के बारे में बता देनी चाहिए. मेरा जो मैंने पढ़ाई जो की है, अपनी ग्रेजुएशन की डिग्री जो मैंने प्राप्त की है वो एम्स दिल्ली से प्राप्त की है. ऑल इंडिया इंस्टीट्यूट ऑफ मेडिकल साइंस न्यू दिल्ली से मैंने ग्रेजुएशन की डिग्री प्राप्त की है स्पीच इन हियरिंग साइंस में. और पोस्ट ग्रेजुएशन की जो डिग्री है हमने प्राप्त की है यूनिवर्सिटी ऑफ मैसूर से speech language pathology field में. So I have got my bachelor degree in speech language pathology and audiology, in speech and hearing science you can say, from AIIMS Delhi, All India Institute of Medical Science New Delhi, and master degree in speech language pathology I got from the University of Mysore. So this is the small introduction about me, and my area of interest is treating voice disorder. And today we are live with Hanif before treatment, and in the future we are going to be post treatment live also. So please subscribe our YouTube channel so that you can watch the post-treatment live also. Hanif, please tell us again what exactly problem you are facing, since how long you are facing.
Okay, thank you. Actually, my problem is puberphonia, which is a female voice, high pitch. So whenever I'm talking, people will mistakenly for a female, so they call me madam like that. And I've been experiencing.
Okay. Just 1 minute. At this age, what is your age now?
29 years old.
29. So I'll say high pitch voice. Puberphonia means a voice problem of puberty. So when the patient age is pubertal age, like 14 years, 15 years, I love to tell puberphonia, but at this age, it's better to tell high pitch voice. Yeah.
High pitch voice, okay, because too long already. So I have a high pitch problem. So, and small voice, whenever I push, I lost my voice also because too much push. And that's why I've been experiencing my puberty time until now. So luckily I met Mr. Sanjay, Dr. Sanjay. So I can try the therapy straight away.
Where you stay?
I'm staying in Malaysia, southern part of Malaysia, Johor.
Okay, thanks for your faith, and we'll do the needful, and we'll stop this live because at 5 p.m. I have some voice therapy appointment. So let's stop this live. Thank you all for joining us and watching us. If any questions are there and I was not able to give the answer, please, if I was not able to give the answer, please write in the comment box and we'll give the answer. Thank you all for joining us and watching us. Thank you all. Love you all.